I'm Dr. Christine Gibson, a clinical assistant professor in the Department of Family Medicine at the University of Calgary in Canada. I created a residency program in health equity, and I've always worked in communities marginalized for poor health outcomes. COVID has cracked open the issues we already had in society around equity, and it's a large part of what's killing us all. A few months ago, I put out a tweet explaining what I considered the isms of the COVID pandemic. We'll start with racism. Racism was a huge problem in many countries regarding the pandemic. Racialized communities were often working on the front lines as essential workers, driving the Ubers and the taxis, working as cashiers and in grocery stores, and working in congregate living facilities like long-term care. They often live in multi-generational family households and carpool. All of these became really strong risk factors for the pandemic. But it was racism, not race, that was driving the inequity. People of color were dying in disproportionate amounts, and their communities were not being prioritized for things like information and vaccination in many cases. One of the places where I work clinically is at our refugee clinic, and it became very apparent the risks that they were in, both refugees, immigrants, newcomers, migrant workers, who all worked at our meatpacking plant, where we had one of the biggest outbreaks in North America. And a lot of that had to do with policies, corporate as well as government. Mentioning racism is a good opportunity to discuss the concept of intersectionality. That means that there's different social positions that you might identify with or you might be within a community of that can leave you especially vulnerable. In the case of the COVID-19 pandemic, oftentimes racialized women bore the brunt of a large disproportionate effect of the work and the risk. Staying at home with their children with precarious work, unpaid sick leave, those kinds of things made their lives even more challenging, and they weren't accounted for by policy or protected economically. Financial access affected whether or not you were able to isolate and whether you could afford to take a paid sick leave. So many people across the world, but especially women, have been financially hit very hard by the pandemic. A lot of people focus on the pandemic's effect on small businesses, and while that's of crucial importance, I think it's also important to take a more global look at the poverty that the pandemic has created and worsened. I'm sure most of us have heard the story that the rich got richer off the pandemic. Sadly, vaccination access has also been driven by the economy and who holds the power in these relationship structures, which means that variants are going to constantly be created and spread in the global south where they don't have access. Embarrassingly, Canada took from the global pool. India and Brazil were fully capable of making vaccines, but globally we chose commerce over lives. We've spoken about the global effects of inequity as it relates to the COVID-19 pandemic. Let's talk about some specific targeted areas. Policy analysts have determined that the Global South didn't have adequate reserves to manage a short-term pandemic, and there will be long-term devastating consequences. We've all heard heartbreaking stories about families trying to find their loved ones oxygen in India. We know that many healthcare systems were completely collapsed under the burden of COVID. And then we understand that so many countries were reliant on tourism, global trade, and aid in order to keep their economies functioning. Imagine a person in a rural village whose food stall has closed down because of isolation, and they can no longer feed their family. All across the world, Indigenous and First Nations community were hit particularly hard by the pandemic. In a place like Peru, the impact on how many elders were lost was particularly difficult. In Brazil, it was even questioned whether this was done by design. Because of the intergenerational trauma from government policy that tried to create a cultural genocide against many First Nations across the Americas, trust has not been earned with the healthcare system, and this has had increasing impact of the pandemic on these communities. Other communities where inequity was highlighted includes the disability community. They were hit because there was this perception that they were going to be much more at risk of catching COVID, and so they isolated themselves more. Access to things like home care was also not as available. Another disability that has been increasingly on the rise in every country across the world has been mental health challenges related to the pandemic. Fear, anxiety, isolation, and the fact that so many people haven't had their basic needs met, relational and otherwise. The stress has been reflected in rates of depression, anxiety, PTSD, and more. Another clinical area where I work is in addiction medicine, where we've seen increases in substance use and overdoses throughout the pandemic. People who've already experienced issues with their social determinants of health, adverse childhood experiences, and intersectional issues like poverty are particularly at risk for mental health challenges. Mortality rates were highest among the elderly, but mental health and isolation were equally devastating. The effects of the pandemic on children's mental health, schooling, and views of safety in the world will be felt for generations to come. This will be an equity issue again, as only those with resources will find support. The good news is that there's many scientific and evidence-informed solutions to these equity challenges. The case for universal basic income has never been clearer. In fact, many countries or regions instituted something similar, presumably short-term for the coronavirus. But these programs could be extended because they proved to improve the health and education status of the people who were receiving these benefits. Imagine if people weren't worried about a paid sick leave, that they could actually stay home if they were ill. Imagine if people didn't have such precarious employment that they'd have to worry about their food and housing security if they were to lose their job, as many did. Just as with precarious income, precarious housing was also a risk factor for the pandemic. A housing-first strategy really affords the dignity for all people so that they don't get stuck in a shelter system, which is an incredible risk if a pandemic spread. Safe, small hubs of childcare were important sources of support for people who were hoping not to spread the pandemic amongst young children. But childcare is incredibly expensive in many communities. This is another factor that was disproportionately hard on women. These kinds of strategies address the social determinants of health. The more that the healing care system and public health can move upstream, that means we can be preventative and create an environment that prevents the risks that cause pandemic spread. Every country should have a national health care that's public and accessible to all citizens. Nobody should go into debt trying to pay for health care from something like a coronavirus admission. Nobody should have to face the decision of whether they can only give oxygen to wealthy people. That causes a lot of moral distress for healthcare workers. National health care should also include rehab. With the emergence of long COVID, and we don't even know how long these symptoms could last, universal access to rehab has become more important. Likewise, we've seen major problems with mental health, both amongst the people with long COVID, as well as everybody who's survived this pandemic or lost a loved one. We need to allow every country to have universal access to resilience building and recovery from trauma, mental and physical. It's very clear that the universal capacity to create and distribute vaccines needs to be expanded quickly. So taking away the patent laws, allowing all of the places that have the ability to make vaccines do so immediately. And then we need to dismantle racism, classism, elitism, ableism, ageism, and sexism. These are the attitudes and biases that we learn even from a young age, and it leads to the social constructs and the paradigms upon which policies and our lived experiences evolve from. It's going to take a tremendous amount of effort to take these apart, and it's going to probably take many generations. It's up to all of us to make these changes that perpetuate inequity.